Hi, I'm Dominic Phiri, a student pursuing Master of Public Health at the Copperbelt University in Zambia. I'm going to present to you an e-poster whose title is Barriers and Facilitators to Tuberculosis Services Uptake Among Men and Women of Childbearing Age in Mumbwa District of Zambia. The background is that TB still remains a significant public health challenge, especially among vulnerable populations such as men and women of childbearing age. Despite the availability of effective diagnosis and treatment, TB services uptake remains low in many parts of the country, hence this study. The methods that were used in this study, the study actually employed a mixed methods approach, combining both qualitative and quantitative data collection and analysis methods. The study population consisted of men and women of childbearing age, as already mentioned. That's between 15 and 49 years of age. Data were collected through surveys, focus group discussions, and key informant interviews. The study used a combination of purposive and random sampling techniques to select study participants. Were there any challenges? Yes, there were there. These included inadequate funding and staffing gaps in TB programs, poverty and food insecurity, then stigma and lack of awareness about TB, that's under cultural barriers. When we look at the key findings or results, we see that the results included the following: inadequate funding and staffing gaps in TB programs, as already mentioned, which limited the frequency and quality of supervision visits, affecting health worker performance. Poverty and food insecurity were the major socioeconomic barriers to accessing TB services. Additionally, transportation costs and lost income due to TB diagnosis and treatment were significant concerns for patients. Then stigma and lack of awareness about TB were significant cultural barriers to accessing TB services. Were there any facilitators to the uptake of TB services? Yes, they were there. And these included the increased awareness. So under that, we are talking about educating communities about TB, improved services uptake, community-based interventions and health education programs, increased awareness on TB symptoms, diagnosis, and treatment. Then community-based interventions and support groups, enhanced TB services delivery. So community mobilization and education packages, improved TB case detection and treatment outcomes. So when it comes to improved healthcare infrastructure, we see that this as well helped to improve services uptake. When we come to figure 1, which is talking about knowledge of symptoms, so 30% of the participants had low knowledge on TB, while 70% had good knowledge about TB. Then when we look at figure 2 is talking about the distance to healthcare facilities. So in that case, we had 40% of the participants had difficulties to access healthcare services due to distance, while 60% had easy access to healthcare services. Figure 3 is talking about the TB services utilization. So in that case, we had 60% of the participants were able to utilize TB services, while the 40% were not able due to lack of awareness. Let's look at recommendations. Recommendations: it's important to increase funding for TB programs to improve healthcare infrastructure and staffing. It's important again to implement community-based interventions and support groups to enhance TB services delivery, as well as continue providing health education programs to increase awareness about TB symptoms, diagnosis, and treatment. In conclusion, we are saying funding is critical in order to improve healthcare infrastructure and staffing. It's important to involve the community so that they enhance TB services delivery, and we continue providing health education programs to increase awareness about TB symptoms, diagnosis, and treatment. I thank you for listening.